Hello everyone, this is Dr. Sultan Moinuddin Shaukat, and today we are going to discuss about second and third trimester ultrasound technique. Before we start, I'll give you my brief introduction. I have completed my MBBS, MD and DNB in radio diagnosis from SAIT GSMC and KEM Hospital. I am gold medalist in the subject, and today I'll be taking a very practical approach to ultrasound technique in pregnant females in second and third trimester. So without any delay, let us begin. So now we'll be starting with the basic video. So first thing which we are doing here is selecting the protocol. And as you all can see, we have selected the protocol of second and third trimester. So this is selection of protocol. Once the protocol is selected, we move to the next part, that is positioning patient. So on the screen on the left, we can see the ultrasound screen, the screen on the monitor, and on the right side we can view the patient. So this is the patient who is positioned, the pregnant patient. LMP of the patient is entered if it is the first scan, or if there are previous scan available, then we would have to enter the EDD of the patient, and based on that the machine will calculate the gestational age, and that would be displayed on your screen once it gets calculated. So the first thing which you are supposed to do in any pregnant patient is to confirm the pregnancy. So now we are moving ahead, and you can very well see that there is a fetus inside. This is the fetus. So first thing we have done is confirmation of pregnancy. Now pregnancy is definitely there. So if we look carefully, go back. So this is the head of the fetus. This we can see is the head of the fetus. So we are able to see this structure, which is a circular structure. This is the head of the fetus, the fetal head, and we are able to see this posterior arrow. It is very important to find out this posterior arrow because it denotes the landmark or the section in which you need to measure the biparietal diameter and the head circumference of the fetus. Now this structure which you are able to see, this is the ventricle of the fetus. Now, as we move ahead in the video, I'll be also showing you the rest of the structures and the rest of the important landmarks. So now we are seeing the head of the fetus. We are panning through the head, and the structure which here I want to emphasize and show you is this structure. This structure which you are able to see. This structure. This is called cavum septum pellucidum. Cavum septum pellucidum. Cavum septum pellucidum is actually the space which lie between the between the two septae of cavum septum, that is the future corpus callosum. Future corpus callosum. So now looking ahead, these are the two thalami which we are able to see. And now look at the probe. Look how we are moving through, and we are panning along the head of the fetus. And this is how we need to obtain dissection for BPD. Now look carefully. I have turned my probe to 90 degrees. And once you turn your probe to 90 degree, you get the coronal section. So just before that, I'll show you again. This is the coronal section of it. This is the coronal section. Now again I've come back to the axial section. So this is the axial section of fetus. Again I'll show you the very basics. this. Let me pause the video. So this is your anti-abdominal wall. This is the uterine wall. This fluid, this is the anechoic fluid which you are able to see. This is the amniotic fluid, and this is the fetal head, and this is the posterior pointing arrow over here in the fetal head. The thalami. In between thalami lie the third ventricle. This which we are able to see is the posterior horn of the lateral ventricle. Now can you see this? This is the portion of the orbit which we are able to see. Whenever we see the orbit, that section cannot be utilized for taking the BPD, and as a result, we need to obtain a section where the orbit is not seen. Now, important point to be noted is that whether you are taking BPD or you are taking head circumference, in both the situation, the section obtained is one and the same. So this is the posterior pointing arrow, this one, and cavum septum. And so we have panned along the cranial structures. We did not find any defect, and now we have gone along the. Now we are going down. Yeah. So we are going down along the fetus. We are panning along the fetus. Look at the gentle movement of the probe, how we move along the fetus, and we are seeing the cardiac activity. And now this is the abdomen of the fetus. You can see the fetal abdomen. This on the right side, like the liver. This on the right side, like the liver. So this is the liver. Stomach bubble lies here, and now these two organs are to be identified, and situs is to be determined whether it is situs solitus or not. So most importantly, you have to imagine yourself as the fetus so that you can identify which is the right side of the fetus and which is the left side of the fetus. Once you arrive at a proper section of the abdomen, the proper section of the abdomen is when you get the stomach bubble, and you can have adrenals in the section, but very important is you need not have kidneys in the section of abdomen. Abdominal circumference is measured from outer to outer diameter. So let us move and see how abdominal circumference is measured. So here we are trying to measure the abdominal circumference. Abdominal circumference is being measured from outer to outer, and we have to take a caliper which is such that it takes from outer to outer diameter of the abdomen. Once the abdominal girth is measured, we again pan along the fetus. This is the fetal brain, and this is cavum septum pellucidum, which was beautifully seen. The orbits of the feta. Now I am panning along so that any anomaly also won't be missed. So simultaneously, you should also look for anomaly even in growth scans. So these are orbit of the fetus. This is premaxillary triangle. Now we are seeing along the fetus. Now you can see that there is amniotic fluid which is adequate. This is the coronal section of the fetus. See how perpendicular the probe is moved, and now you can clearly see this structure. This is the cerebellum. So the coronal, in case of coronal anatomy, this is the coronal section of the fetal head, and we are able to see this posterior horn of lateral ventricle. This is tentorium cerebelli, and this is what you have got, cerebellum. So when you take transverse cerebellar diameter, you have to take it from here to here. That will give us the transverse cerebellar diameter. Transverse cerebellar diameter can also be taken in axial section, and it can also be taken in coronal section. Now this is transverse cerebellar diameter. Transverse cerebellar diameter corresponds to the gestational age till 28 weeks of gestation. Now here you are able to see the amniotic fluid, the umbilical cord which is there inside. Now we are taking BPD, which is biparietal diameter. So we select BPD and then we measure it from outermost edge to the inner table of the skull. So it is from outer to inner. Now we are measuring the head circumference. The head circumference is measured from outer to outer area. So we'll put a circular caliper which will help us to measure from outer to outer. Case of head circumference. Now, after measuring head circumference, abdominal circumference, and BPD, we are moving down. This is the bladder of the fetus. This is oblique section. Now you can see that this is the bladder, which is this is the bladder, the urinary bladder, which is clearly seen here. And once you locate the bladder, I'll go back. Yeah, once you locate a bladder, just move your probe perpendicular to the bladder. So see how I'm moving my probe. Once you locate the bladder, just move your probe perpendicular to the bladder, and yes, this is your femoral length. This is FL. Once you obtain femur, what you do is you decrease the depth, decrease gain, you select FL, and you measure the diaphyseal length of femur. Very important, you have to take diaphyseal length. The length should not include the bony spur or spur artifact, or else it will give us the false measurement. Now we come back to the chest. We are able to see these are the four chamber view, and very important. This is bifurcation of pulmonary artery, which we saw. Yeah, this is the bifurcation of pulmonary artery, and we can confirm it by putting colors. I'm moving down. We are scanning below. This is where the umbilical cord is entering inside the abdomen. Stomach bubble is seen well. Now this is the spine of the fetus. So this is achieved by obtaining sagittal view of the fetus. So how is this obtained? Look carefully. I'll take it back. So we had an axial image, and now see gradually how my probe is moving. I am moving my probe. So axial, and now I move my probe perpendicular to it, and I get a sagittal image. Now this is the sagittal image. This is the spine which I'm able to see, and most importantly, this is the heart. Yeah, now, most importantly, this is the ductal arch. So now we are able to see this is the spine of fetus which is running along the posterior end, and this is the diaphragm which is separating thorax from the abdomen. This is the thoracic cavity, this is the abdominal cavity, and this is the ductal arch of the fetus. Ductal arch of the fetus. We are able to see ductal arch. This can be confirmed by putting color inside it. This is the pumping heart. This is the ductal arch, which is seen very nicely on side, containing as descending thoracic aorta, and it is confirmed on color. Now look carefully. Again, I'm panning along in sagittal section. This is the fetal bladder, which we can see very clearly. Now gently try to look for any diaphragmatic hernia in sagittal section. Color should be put to look for IVC. You can see the ductus, which would be seen meeting IVC. Now this is fetal urinary bladder again. Now this is two vessel cord, which is seen alongside the urinary bladder. This is umbilical cord is entering, and you will see the aliasing where it meets IVC in the form of ductus venosus. Cardiac activity, the four chamber view of the heart. This is the right atrium, the right ventricle. Now I'm moved above, so this is the 3VT view, and we are able to see pulmonary artery bifurcation, aorta. Now this is very nicely showing the pulmonary artery bifurcation. So in fact, now even if the child has come to you for a routine scan, it is our duty to also screen for gross anomalies of the fetus. So most importantly, we always need to look for four chamber heart. and at the same time we also need to see for the 3VT view. 3VT view is where you see three vessels and trachea. So pulmonary artery, aorta, and SVC is what you need to look for in that order of sizes. The details would be discussed in 2D echo video. So now here you are able to see the pulmonary artery. This is the heart which is functioning. You are able to see the stomach bubble below the diaphragm. This is the fetal head. Now we are able to see the placenta. Now we are looking for placenta. See how we are panning to look for placenta. This is the placenta which is located posteriorly. Now I'm panning alongside to trace along the length where the placenta is extending and the placenta finishes off. So placenta is not low lying. Now most importantly, I go down. So I've gone below and I have taken the longitudinal section. So you are able to see this. Now we are able to see this region. This is the cervix. This is the cervix. This is the cervix. And most importantly, there is no placenta within 2.5 centimeter of the internal os. That means that placenta is not low lying. And at the same time, look carefully that the cervical internal os is closed. Most important. And also need to give the length of the cervix, and that has to be mentioned in our report. So we have to measure the length. Now we are placing caliper, and I have placed my one caliper on the internal os, one along the external os, and this length is 4.7 centimeters. So it is not a short cervix. If it is less than 2.5, we call it short cervix. And now I am again panning to look for amniotic fluid and to look for the fetus, any other anomalies. Now again I will show you how do. Now you look that the head lies up, the breech is the presenting part. See, I'll show you again. Yeah, first measurement of the cervix. After measuring the cervix, look how it is being panned. So the presenting part is breech because that breech is lying below. And now as I move up, so see I am moving up and you get head region. So head lies above. So as the head is above, head is, so the presentation is breech presentation in the present scan. And we are able to see this posterior pointing arrow, the placenta which is lying posteriorly, the amniotic fluid, and this is how you freeze it. Now we can see the fetal nose, umbilical cord. This is the umbilical cord. Now look carefully for the palatal structures. Now this here is the umbilical cord. Always scan along the neck. If there is any loop of cord along the neck, this should be screened. Now these are the fetal limbs. So also try to look at fetal limbs. Now you are able to see this, the hand of fetus. You are able to count the fingers even. These are 5 fingers and the thumb. Now you can clearly see that these are the fingers of the fetus. So we have demonstrated the hand of fetus very nicely. We are also able to see the phalanges and metatarsals, the radius ulna. Similarly, you need to look on the opposite side, the other hand too, so that any gross anomaly in the fetal hand upper limb is not missed. Now we move and come to the lower limb. So again, we are locating the bladder. And once you see the bladder, I have told you to move your probe perpendicular, and you will be able to see the femur and tibia fibula. These are tibia and fibula, and this is the leg of the fetus. So here you are able to see the leg, and this. So you can clearly see how the fetus is extending. You are able to see. Yeah, I'll show you again. See how they look here. Yes, this was the extension. This was the movement which is performed by the fetus at its ankle joint. And again, you are able to clearly see the tibia and fibula. And most importantly, when you see tibia and fibula, you should not see the metatarsal bone in the same image, or else that signifies clubfoot. So now again, this is urinary bladder. This is the spine. Try to look for fetal kidneys. These are fetal kidneys here. This one, the fetal kidney. Now, pan along the fetus. Look at aortic arch. This is aortic arch. Aortic arch will show its branches. So always look if the aorta is not continuous, that denotes interrupted arch. So try to look for aortic arch continuity too. Now this is the cerebellum. Again, I have demonstrated cerebellum, and this is a beautiful image. Now this structure here, which you are able to see, this one, this is cerebellum, and we are able to see that behind the cerebellum, this area. This is called cisterna magna. Most importantly, this cisterna magna should not cross the cutoff of 10 mm. If it is more than 10 mm, we call it mega cisterna magna. If there are any cystic lesions in this region, also those should be seen, especially to diagnose out Black spouse cyst and such other important pathologies. Cystic dilatation of the fourth ventricle, which is seen in case of Dandy Walker malformation. All these are important anomalies which should not be missed. Now, most importantly, when it comes to few other pathologies like Vermeer hypoplasia. Vermeer hypoplasia is one such disease which is diagnosed in delayed gestation, and so that this is one which can be missed in earlier scans. Now, transverse cerebellar diameter is taken, as I already mentioned, in this view, and this transverse cerebellar diameter should correspond to the gestational weeks till 28 weeks of gestation. Now, moving ahead, this is the coronal section, and we are able to see the fetal head again. This is the axial section of the fetal head. We are able to see this bright thing within the ventricles. This is nothing but the choroid plexus. Now, this is how, again, I am demonstrating how to take BPD. So, we have taken a view where you are able to see these two thalami, posterior pointing arrow posteriorly, and you are measuring from outer inner table of the skull. So, this gives BPD. For again head circumference, you have to take it from outer to outer, a circular caliber, then extend the circular caliber to include the complete dimension. Now, most importantly, the orbit should not be the part of BPD. Now, this is umbilical cord. Here we are able to see, look for entanglement of the umbilical cord. Or short cord is when it is less than 45 centimeter. Now, I am demonstrating here how to take thoracic diameter. So, thoracic diameter is taken bit differently. Now, here I have taken a view where you are able to see the fetal thorax and the four chamber view of the heart, and the thoracic diameter is taken, but the difference between thoracic diameter and abdominal diameter is that thoracic diameter is taken from inner to inner, so only you will include the bony thorax and you won't include the outer soft tissue, whereas in case of abdominal circumference the outer soft tissue is also included. So that is the difference between taking the thoracic diameter and taking abdominal diameter. We shall discuss this in details when I will be talking about the various measurements in case of fetus. So this is how we take the thoracic diameter. It is inner to inner. So just we include the thoracic wall, bony thoracic wall. Now this is the umbilical cord. I've kept Doppler within it, and you can see this pulsating umbilical artery. So we have got single umbilical vein, an umbilical artery. Now this is placenta, and now I'm demonstrating how to take the amniotic fluid. So most importantly, when you are measuring the amniotic fluid, we divide the entire abdomen. So you here, this is, look here towards the ultrasound. So entire abdomen is divided into four quadrants, and in each quadrant you will be taking the deepest pouches 1, 2, 3, and 4. This is how you'll be taking. And most importantly, look how the probe is positioned. So the probe has to be kept perpendicular to the table. You cannot put the probe in any angle. So the probe has to be kept perpendicular to the table. This is the most important prerequisite when you are measuring amniotic fluid index. So now, the firstly, what you need to look for is this thing. Now, once you have divided the abdomen in four quadrants, look carefully how I'm measuring the amniotic fluid index. Now this is, I'm measuring it in the first quadrant. So in the first quadrant, it was around, take again, yeah. So this is in the first quadrant, it is around 2.1. So now you have to note it down that in first quadrant is 2.1. Then you have to measure it in the second quadrant. See how my probe remains perpendicular to the table. And here I'm measuring it. This is 4.3. So this is 2.1 plus 4.3. You have to add this. Now you have to see it in the third quadrant. Very important. If fetal part is there, you need not take that portion for AFI calculation. Fetal part or umbilical cord. You should take a pouch where you don't have either the fetal part or you don't have umbilical cord. So now, yeah, so you need to obtain a portion where there is no fetal part or no umbilical cord, and that is where you have to measure the deepest length. Now, very interesting, sometimes in pregnant females, you might get findings which are different from what they have presented with. Sometimes the female might just come to you for a routine uh, a scan, growth scan, but sometimes you might find anomaly in the fetus, and you need to mention that anomaly. It is very important. Mention that, or else it leads to a big medical issue. Now, at the same time, one more thing I would like to discuss, as in this case, you look carefully. Now, look carefully. So, incidentally, when we were examining the patient, we could locate spleen of the patient, and you see that there is a huge splenomegaly. So I have asked, so I started looking for spleen, and can you see that this is the huge spleen of the patient, and this patient had a massive splenomegaly. So this is how I'm taking lateral decubitus of the patient, and I start looking for the organ. You can see that this is dilated. This is a dilated splenic vein. I have changed my protocol to abdomen penetrating view, and now I'm looking for the spleen. You can see that the splenic vein is dilated, and there is a huge spleen. The huge spleen on measurement, it is around 17.9, so around 18 centimeters. So that's a huge spleen. So when you get any abdominal pathology in a pregnant female, now here I have put color, so I am able to see that the splenic vein. But most importantly, I will not measure in the color image. You should always take measurements in 2D image after removing the color. So splenic vein is also dilated. It is measuring around 19 mm here. Now, very important lesson to learn, that sometimes you might get such incidental findings, and at that time you need to look for the cause. And now I'm still looking at the liver of the patient, and you see that this is not normal. Again, you are able to see multiple collaterals which have replaced the portal vein, so there is portal cavernoma formation. And look carefully, this is GB, and you are able to see multiple peri-GB collaterals also. So most importantly, what do we learn in this is that when the patient comes, let me summarize all the findings. Pregnant patient comes to you, so you need to look for four important measurements when you are doing the growth scan. That is biparietal diameter, the head circumference, the abdominal circumference, and the femoral length. These four diameters will give you the assessment of what is called estimated fetal weight, and this is what you have to give it in your report. This is most important. At the same time, you should also look for placenta, whether the placenta is low lying or not. You need to look for cervix, the length of the cervix, whether the internal os is closed or not. This is very important. The funneling of the cervix, which we shall discuss in subsequent chapters. All these things need to be mentioned in our report. Then we should look for amniotic fluid. Amniotic fluid, we need to do it in a four quadrant way, and we need to add all those things, and we need to give it in the report whether the amniotic fluid is adequate or inadequate. We shall also have a separate section, a separate lecture on amniotic fluid index. Now, after amniotic fluid index, We should pan along the fetus and should look for any other anomalies, especially limb anomalies. Those all should be mentioned in the report. We should try to look for club foot, any case of cleft palate, all this should be reported. Now, after you do all this, most importantly, sometimes you might also have other incidental finding, like we had in this case. There was a huge splenomegaly and of portal cavernoma along with perigee collaterals. And interestingly, this patient turned out to be a case of sickle cell anemia. So sometimes when a sonographer has to be very vigilant and he needs to look for extra findings, and all those incidental findings or patient complaining of pain here and there should not be missed. And always we need to be curious and we need to look into all these pathologies for the better diagnosis of the patient. So hope you enjoyed this session of technique on ultrasound, and in subsequent sessions I'll discuss in details about how the measurements are to be taken, what type of sections are to be obtained, and I hope you will like those sessions too. Thank you.